reached a new level for health insurance companies. The case of Archimedes Global Georgia. So, what is universal health coverage? Universal health care means that everybody can afford proper, promotive, curative, preventive, and rehabilitative health care when they require it and at an inexpensive charge. It covers both general and specific demands. Nowadays, both developing and advanced states are trying to issue, and it's usually owned by the government, and community-based health insurance. So in this model, there is low level of risk, but there is high responsibility from the community. So, what kind of situation was there in healthcare system in Georgia in past decades? We had 3 public insurance programs. First, voluntary health insurance program in the years of 1999-2006. So, it was covering just only specific demands, and only 50% coverage was appeared, and the number of insured people reached only 100,000, so it was not quite a successful result. The second program was under the name of primary program in the years of 2007 and 2009. It was covering the health insurance for vulnerable segments of the population, and the number of insured citizens reached about 200,000. And the third program, cheap insurance program, in the years of 2009 and 2011. It was covering the population under poverty level, about 1 million people, artists, professors, and also some homeless children too. So, what is happening nowadays? Nowadays, Georgian healthcare system is regulated by 4 governmental resolutions, which define the insurance procedures for socially vulnerable persons, internally displaced persons or refugees, teachers, professors, and so on. The insurance conditions for the children aged 0 to 5, females who are over 60, males who are over 65 or pensioners, and children with disabilities aged from 0 to 18, and the persons who have pronounced disability. That's the main package which is used in Georgian health insurance system nowadays. Also, these resolutions define the conditions about business relationships between insurance companies, hospitals, and insured citizens. It also defines the financial sanctions and fines in case of violation of rules, and medical care for the publicly insured citizens. Maybe Georgian healthcare system structurally is developed more or less nowadays, but there was no infrastructure in order to execute the mentioned program. So the government implemented the hospital sector development program under the plan, which was considering rehabilitation of 100 hospitals, including 4,000 beds in Tbilisi capital and 3,500 beds about in Georgia. To sell all the public hospital to private health insurance companies in the way of privatization, to attract private investments, to increase the level of competition, decrease the prices, and improve the quality of medical service, and to cover the entire territory of the country with hospitals of international standards, of course. But what was the situation of...
Were they implemented or were they just plans? Because you refer to them as plans. Were these initiatives implemented?
You mean this?
Was considering?
It was considering this main...
This was implemented?
Yes, okay. By the government. So the government made the insurance companies to do these things.
So they are running now hospitals?
Yes.
All
insurance
hospitals?
So the insurance companies, private insurance companies, are executing public insurance program, and also they are owning the hospitals.
They own the hospitals?
Yes.
Throughout the level?
Yes.
Rajona centralная больница, участковая больница, all the way to the small
Yes. After will be explained it clearly more. So, what was the situation on health insurance market? In 2011, there were 3 market leaders. The medical staff and personnel must be trained somewhere in developed country, and it was chosen Israel because we have close relationship with Israel.
Okay.
And also this NGO, Medical Georgia, was participating a lot in this process, so the government made them to train the staff and personnel.
And the salary requirements were always set by government?
No, then the salary requirement was set by this personal and trained people because they suffered a lot. They had to train like 1 year, so they deserve these high salaries.
Okay, okay.
Very interesting dissertation. I have many questions because I'm curious about the arrangements. I've been doing consulting work in different countries of the former Soviet Union on these reforms attempt. So do I understand correctly that specific territories, okay, in this case the territory of the municipality of Tbilisi is entrusted, is awarded to a company, in this case,
yes.
this company. What happens if I'm not registered in Tbilisi?
Yes.
And I'm in Tbilisi, and what happens to Tbilisi residents when they are in Batumi on holidays? Who is taking care of their...
Okay.
Because people move, I mean, they are not, they might be registered in one place, but some people move to Tbilisi, but technically they are not residents for all possible reasons. They are students, they are traveling, they are visiting parents, they are there illegally, although they should be registered in Kakheti or somewhere else. And people from Georgia, from Tbilisi travel to other.
I understand that question. So,
in other terms, since a single insurance company becomes the monopolist,
yes.
How do you manage patient mobility and the financial arrangement related to patient mobility?
Okay.
And the administrative expenses.
Yes, first I will answer your question and then yours. So first of all, as I told you, the beneficiary has to take the health insurance voucher from the Ministry of Health, right?
Okay.
So if the beneficiary proves that he or she needs the urgent care, then he or she will be accepted to receive the medical service in Tbilisi, not in Batumi, for example, if he lives in Batumi. But if the case is not urgent and it's just stationary case,
Okay.
then he or she will have to go back to the residence place and get the medical service there. Concerning the prices, I know that you think that there will appear the monopoly, right? Because one company is operating on each area. No, because the Ministry of Health controls the prices very, very strictly, and there is a special department, mediation department in Ministry of Health, and every citizen, if there is some problems, for example, about
the price of the insurance policy.
I'm
The
sorry?
price meaning the price of the insurance
Yes,
policy
yes,
the
yes,
citizen
yes,
is
yes.
paying. Okay.
He or she goes in the mediation department, and the mediation department will take care about this problem for sure. There is no problems posed with this case, with this problem, with this situation.
Okay, so the thing is like, let's say I become an urgent case. I'm in Tbilisi, I'm not registered in Tbilisi. I go to the hospital, I receive medical assistance because my insurance in the district I'm registering covers also urgent care in another district,
yes,
and then the two insurance company. Okay.
If so, only if it's urgent care,
Yeah,
urgent case.
Yeah.
My other question is this.
Who decide on the urgency?
I mean, if you go to the
To the yard.
pronto soccorso.
Yeah.
The emergency room. My other question is this. You suggested, and I tend to agree for a place such as the capital, the decoupling of purchaser and provider, so not having the insurance company owning the hospitals. Because in this way you increase competition among suppliers, and the insurance company can select the best providers.
Yes.
Would you suggest this only for Tbilisi or for other regions as well? Because traditionally, in the old system, you have a rayon and you have one hospital, so that's the only provider. So in those cases, would you suggest an integrated system? Because in reality, you have, how is that called? You have a bilateral monopoly. You have a monopolist
Yes.
and you have a monopsonist on the other side.
Yes.
So you cannot really ask someone else, especially if it's a large district with just one hospital, because it's very sparsely populated, it's a mountain region or something like that.
I would suggest, on the other hand,
It makes sense in Tbilisi, for sure. I mean, you have different
yes, but
cities.
in regions also it's very important, because in regions people are more poor, for sure, and in regions it's much more important the competition between hospitals. because it will decrease the prices for them. In Tbilisi, there is no problem for medical services.
But you don't have competitors. I mean, you have one provider.
No, I mean if my recommendations will come true in this way. So in regions, it's more important because it will increase the level of competition and which will decrease the prices for sure. I would recommend it more to the regions. It's my opinion, just.
No, my concern is that you have one hospital.
Yes.
You have a traditional district of 30, 40,000 rural population, and you have one hospital, 200 beds, 4 departments, typical, with the basics, surgery, medicine, urology, and gynecology, and that's it. I mean, there is no demand to have 2 hospitals.
Okay.
So you basically can have one.
Yes.
So, it's as a financing body, as an insurance company, I'm not going to build another hospital because you have 400 peasants there, 40,000 peasants. You cannot afford much.
Yes, but on the other hand, if the hospital network companies will be owned by another investors, for example, I'm an investor, I go in Batumi, I will build another hospital, I will offer to the health insurance company lower prices, and of course he will create business relationships with me.
Fine, I take the point.
Irakli, another question is a little beyond the scope of this work, but just to understand. Why do you think that Georgian government went for this solution to implement universal healthcare coverage and not one of the other possible from the many of institutional arrangements that you were showing us? It's like, very briefly, it's like...
okay, first
no, I know that probably there is not a clear answer, there is an answer, but it's very complex, but just beyond the scope.
First of all, the previous government was finishing its deadline in 2012, so they wanted to create a new image for the population that they were trying to help the population with medical service, with a new healthcare system. But I think this model of healthcare is much more comfortable for the population because, for example, there is another method. You go for the medical service, you pay the full amount, and then the insurance company must compensate. That's bad because, yes, because I don't have money for this, for example.
No risk pooling.
Yes.
Okay. So, I see it's also a way to generate extra revenues.
Yes.
Like freeing up governmental money for something else, because
you go in the hospital, the person goes to the hospital, and if you are in a specific package, you just pay zero, nothing. You just receive the medical service and that's all. The money is compensated from the government to insurance companies. You don't take part in this process as a payer.
Great.
Thank you very much.
Thank you.
Yeah, I want to give special thanks to my supervisor and tutor and best professor, Professor Irakli. Sorry.
You see, like here, I like this. This is like an X Factor moment. That's why I do this. They're like, you're a true star. Thanks.
Thanks a lot.
La mia punta di diamante, che spara.